who looks like there's no audio on Stella's video. We'll work that out. Shannon, I'll give you a second to figure that out. And while you figure that out, I'll do the brief introductions that I was going to do. My name is Rusha Chavez Cardenas, the Director of Strategy and Partnerships with Civic Health Alliance. Thank you for joining us for our webinar this evening. It is all focused on there is no off year. Oftentimes we think that the years in between elections is when we can take a break and kind of catch our breath. We can catch our breath, but this is also a very active policy year. So this is when we see lots of fiscal legislation, lots of policy legislation, and other actions that are taking place that are going to be implemented this year to get ready for the presidential election. And so we have some special guests with us today that we'd like to introduce to you. And hopefully we have Stella's video that will have some audio in, and then we'll pop over to get to these panelists.
Hi, everyone. My name is Stella Sappho, and I am one of the co-founders of the Civic Health Alliance. I'm really excited to welcome you to our webinar tonight, There Is No Off Year. I wanted to send this message across because I can't be there in person, but I wanted you to know that we at Civic Health Alliance are so excited to have you join all of our different educational webinars. Tonight's webinar, There Is No Off Year, is incredibly important because as a nonpartisan group, we know that the work that we do at every point of the year and every election really increases our chances of being effective in improving upon the policies that may have a negative impact on our patients. So we encourage you to learn as much as you can, to take all the tools and to apply them in your general context. We at Civic Health Alliance really pride ourselves in being able to bring civic engagement into all healthcare spaces to improve the lives of our patients, our peers, and our communities. Thank you for joining us in this journey.
Thank you, Stella. So like I was saying, for us, civic participation occurs year long. So in today's discussion, we can go on to the agenda slide, please. We're going to discuss a few things, how funding and government investments and the elections infrastructure in 2023 will impact voters in 2024. We will explore ways healthcare workers and healthcare delivery organizations can advocate for policies that advance civic engagement this year. And we'll learn from our panelists how they plan to advance civic engagement throughout this year in preparation for 2024. Next slide, please. As Stella mentioned, our organization, Civic Health Alliance, is a nonpartisan coalition of health and civic leaders advancing America's health through civic engagement in care settings and in communities. Next slide, please. I'm going to hand it over to Maya to introduce our panelists.
Hello, everyone. So our lovely panelists today, we have LaKenya Jordan, who serves as the Deputy Secretary of State of the California Secretary of State. She has over 13 years of state leadership experience and most immediately has led the California Commission on the Status of Women and Girls as Executive Director. LaKenya additionally served as Director of Legislation and Governmental Affairs at the California Department of Alcoholic Beverage Control. She earned a Bachelor of Arts in Communication and Organization Management from St. Mary's College and a Master of Public Health from Touro University. She's a Senior Fellow of the American Leadership Forum and a graduate of the Leadership California Issues of Trends program and an active member of the California Women Lead. We also have Cynthia Romo, who is the Civic Engagement Program Manager at AltaMed Health Services Corporation, a leading healthcare system providing care to more than 400,000 Southern California residents. Currently, her role focuses on developing and supporting program content and implementation of company-wide civic engagement initiatives. In this role, she leads the implementation of activities, outreach, education, voter registration, Get Out the Vote, GOTV campaign, and census education and outreach initiatives. Collectively, Cynthia has over 20 years of experience in the healthcare sector, advocating for underserved communities through various roles and federally qualified health centers, from program manager to clinic manager roles. We also have Ashish Sinha. Ashish serves as the Chief of Staff with the Institute of Responsive Government. Additionally, Ashish directs national implementation working groups of former election directors and technical assistance experts who provide support to states in the implementation of new election and voter registration policies. Previously, he worked in philanthropy as the program director of the Funders Committee for Civic Participation to strengthen philanthropic investment and civic engagement across the country. Ashish is based in Washington, D.C. I'd like everyone to welcome our panelists tonight. Thank you so much for being here.
Thank you, Maya. LaKenya hasn't joined us yet, but things could have gone away where she got pulled with the Secretary of State. Hopefully she can join us, but we know that these positions are high profile and sometimes last minute things come up. So hopefully she can sneak in. If she can sneak in, we're going to get her in. And if not, we're going to bring her back so she gets a chance to talk to you guys. We're going to pass it over to Ashish. He's going to do some level setting for us and just explain where we're at this year and the trends that he's seeing and what his organization is tracking for 2023.
Thanks so much. I'm so excited to be here with all of you to do a little bit of a preview of what we can expect in 2023. I love the framing for this discussion that there is no off year. I feel having worked in election policy for most of my career, I think one of the things that is most important to understand is that most states are enacting changes to election policies, voter registration policies, the year before a federal election. So 2023, as we are already embarked on state legislative sessions, is such a critical year for a lot of the issues that matter to many of us in terms of voter access and in terms of removing barriers for communities to be able to cast their ballot. And so what I wanted to do today was talk a little bit about some of the trends that we've seen over the last few years, I think particularly from 2020 to 2023, and then to get into a few different issues that I think might resonate particularly with this group as well. So I'm going to share my screen and just give me a thumbs up if it's showing. And if not, I'll try one other thing. Wonderful. So I think, as you can all imagine, 2020 was a watershed moment when it came to elections. It was a watershed moment for so many of the different issues that we all engage on, including public health. But it truly changed a lot of how election officials approach elections and approach election administration. I think prior to 2020, there was a lot of interest from election officials to obviously administer the most effective election possible. But 2020 sort of threw out the rule book in terms of what a good election looked like. It was clear that voters needed multiple ways to be able to access the ballot, to be able to safely and securely be able to cast a ballot. And so vote by mail, early voting options, among other reforms, became something that many states that hadn't considered those reforms previously quickly adopted and implemented all within the space of a few months. It was truly sort of an unprecedented effort from election officials and something that LaKenya and others who were in those roles at that time had a lot of, should get a lot of credit for the amount of work that went into making the 2020 elections happen. I think, unfortunately, after 2020, with both misinformation that was spread by elected officials as well as other leaders in the United States, election officials have been facing unprecedented challenges. That's taken the form of, unfortunately, threats. There's been increased threats to election workers, election officials, as well as obstruction of election administration. You can imagine if you have ever met your local election official, a lot of these people took the job because they have a great sense of public service. They want to do right for their community. They never imagined that they would be in the public eye in the way that they've been since 2020. And that creates a lot of challenges and a lot of sort of risks for election officials who have not up to this point had to deal with that. I think the second trend that's important to keep in mind is that legal protections that had been offered under the Voting Rights Act have weakened over time. That's partly courts' interpretations of the Voting Rights Act, both through the Supreme Court as well as state Supreme Court rulings. And so there's been an increased reliance on state legislation to determine what are the rules for casting a ballot and what are the rules for being able to register to vote. One of the other sort of trends that we've seen is a significant increase in the number of election laws being debated at the state level, both positive and negative. And so since 2020, a lot of state legislators, a lot of governors have had a lot of pressure to be able to sort of revisit how elections are conducted in states. And I would say that I think despite what may often come up in the news, overall, the trend has been positive. So we can take some hope in the fact that more states are adopting policies that allow early voter access, either through mail or through in-person voting opportunities. And I think that's largely because of the sort of role that election officials have played in both making their case to legislators and making the case to the state that these are options that provide good customer service to voters and allow more communities, particularly those who have been disenfranchised under previous laws, to have greater access at the ballot. So I want to run through a few items that we can expect in 2023. One is a policy called automatic voter registration, which I'll talk more about in a bit. This is a policy reform intended to reduce the barriers related to voter registration within the country, and has had a great impact across many states, with over 20 states adopting this policy, including California. Unfortunately, we'll likely see continued anti-voter legislation in states where misinformation about the 2020 election continues to persist. When I've talked to election officials, they sometimes feel like they're still litigating the 2020 election, even though it is 2023 now. And that has had some influence over legislators who are trying to introduce laws that would, for instance, implement a full hand count of all ballots, and other policies that make election administration more challenging. The third sort of thing that we are likely to expect are election officials facing significant funding challenges in states where the state itself cannot fully fund, or local jurisdictions cannot fully fund the cost to modernize aging election infrastructure. The federal government for the last 2 years has failed to appropriate the same amount of funds that they did between 2018 and 2020. And the need for federal funding to supplement state and local funding is a critical issue, and one where there'll be a lot of effort put to try to make sure that that federal support comes. And lastly, states continuing to improve the ways that voters can cast a ballot. So even with some of that anti-voter legislation, there's still a lot of interest from legislators and governors to make voting more accessible for voters. And I think we can continue to see good early voting options and vote by mail options being discussed at the state level. I know we're going to be talking about this more, so I'm just going to briefly mention that the public health sector can play such an important role when it comes to the debate over election policy. Public health professionals and healthcare workers continue to be trusted voices and can help to validate a lot of these reforms in a way that traditional messengers on these issues simply can't break through. And so there's a very important role for those of you who have that as a background or have access to those professionals and those workers to be able to be important validators in this discussion. And I would say that it also helps to reframe voting and voter registration away from just being a partisan issue, and one about health outcomes and how these policies can really lead to better outcomes for communities. The one issue I wanted to focus on is automatic voter registration. It's partly an issue that our organization works on, but also partly because it has an interesting intersection with the public health community through one of the agencies that we hope to expand this to. And so just quickly, automatic voter registration fundamentally is about reducing the administrative burden associated with registering to vote. I think many of you probably know this intuitively, but that voter registration was partially created in the United States as an intentional barrier. More specifically, it was created as a barrier for Black Americans to be able to access the ballot after enfranchisement. And this is something that does not need to be the case. Most modern democracies make voter registration a streamlined and quick process for all eligible voters within the country. The United States is one of the few that creates a two-step process for voters to access their ballot. Administrative burden, I know, is something that a lot of those in the public health sector are familiar with, and it creates unequal impacts in terms of the communities that are denied access, and makes it harder for lower income communities, people of color, those with language difficulties to be able to overcome the difficulty and the challenging laws that sometimes are employed at the state level around voter registration and the vote. Automatic voter registration, as I mentioned, is in over 20 states. There are many different models for this, but it has become something that in both states in different geographies have become something that is a particularly popular reform, primarily implemented at motor vehicle agencies. However, the reason that I wanted to raise this policy issue is that currently there's a debate about expanding automatic voter registration to Medicaid. With over 80 million people enrolled in Medicaid across the country, and a federal law, the National Voting Rights Act, requiring Medicaid to offer voter registration services, this could become one of the most significant ways to be able to close the voter registration gap in this country. In every state, there continues to be unregistered but eligible Americans who continue to cite voter registration as the most significant barrier for them being able to cast their vote in an election. While Medicaid may not get us to 100%, it's likely to get us up to 95 to 99% in a lot of states who have significant communities who are participating in the Medicaid program. Colorado, Nevada, and 9 other states have been provided authority by state law to implement this policy. And the next step is for CMS to provide approval under Medicaid confidentiality standards to allow for those states to begin implementing this policy. And sorry, just a few concluding thoughts before we enter the discussion. I just wanted to mention that 2023 certainly will not be an off year. You will see in almost every state a significant intensity at the state level around voting and voter registration legislation. This will come in the form of proactive laws that are trying to make things easier and more secure for voters to be able to cast their ballot. But unfortunately, in some states, it will come in the form of anti-voter legislation that's intended or fueled by misinformation. I think Medicaid AVR is a really exciting new policy. And I think it's also just an example of how there can be good collaboration between the public health community and the voting rights community for finding creative ways to be able to leverage the strength for both communities to be able to register more voters and allow more voters to be able to cast their ballot. And so with that, I will pass it to Rasha.
Thank you, Ashish. Thank you for doing that. We really appreciate it. And now all of our panelists are here. I'm so excited to talk to all 3 of you. But I want to start with a little bit about, just in a couple of minutes, we'll round robin. Can you tell us your story about how you arrived at this work? And who wants to go first? Let's do Cynthia.
Thank you, Rasha. Thank you, everyone, for being here. I'm excited to learn a little bit more and how we could collaborate. My name is Cynthia Romo from AltaMed via Mexico and Southeast Los Angeles. That's where I grew up, and I currently reside there with my family. So, and again, my pronouns are she, her, hers. I grew up in a working class majority Latino community. It still is that. my education and career has always focused on healthcare, because if we don't have that, it's very hard to do anything else if we don't have access to quality healthcare. And that's a big, you know, a word to say, quality as well, for our communities and people of color. So I grew up here and I grew up in Mexico, so I got to see the difference, but I got to see the impact health has on our communities. For example, growing up, and I'll say very quickly, I grew up in the 80s where the smog was incredibly horrible. If anybody remembers that, you had to stay indoors. I have asthma. So anytime, my parents, again, very low income, couldn't afford air conditioning. So we had to stay indoors. They did as much as they could to protect me and help me. But again, that access to healthcare, access to voicing our concerns and voting elected officials who represent our community was not there. So eventually, when I became a US citizen, and I was very nervous to walk into my polling location and cast my vote, I understood that one, I'm voting with my community. I represent my community, so I'm not there alone. And two, I'm electing individuals who are going to advocate for our community. And I also had a connection where most of my background is in clinic administration, so I would see the effects of what we call the social determinants of health, which I didn't know that was it. Growing up, I just knew, okay, well, we can't afford this or we can't afford medicine. And I saw how much more we could do if we involve our patients to voice our concerns, to have a pathway to express themselves in all these civic engagement processes, not necessarily just in healthcare. But again, it's truly near and dear to my heart to engage our community, to have culturally and linguistically accurate representation of our communities. So hopefully that's a little bit about me. I'll hand it back to you, Russia.
Thank you. Kenya, what brings you to this work? How did you get here in a couple minutes?
Oh boy. Okay. It was it was a combination of things. First of all, thanks for having me on here on behalf of Secretary Weber. We appreciate being able to engage with advocates and with the community. I am a grassroots person. I came from the community doing advocacy work and found my way to government through kind of a windy path. So let's just say as a child, I loved science. I love medicine, was a little bit of a nerd. I always wanted to be a doctor. And so I set out on the path of public health and on the path of going to medical school. So while interning at Children's Hospital Oakland, by the way, I should have said I'm from the Bay Area, right here in California. And I grew up in a small community called Vallejo. And so working at Children's Hospital Oakland, it was, really a mirror of my own city, inner city, urban area, community, a private hospital. But the doctors there were working on the social determinants of health. And that just opened my mind up regarding what health could be. Everything from the clinic that was on East 14th and Youth Uprising there, Dr. Barbara Staggers kind of showed me how doctors could be advocates at the county and city level for resources and, could also still bring their medical profession into the hospital. So I was just inspired to learn more and began organizing community advisory boards for Black infant health, began engaging with my own, at the time, graduate university, which was Touro University, for organizing their community advisory board, bringing people from the community into the conversation for how the students in the hospital could serve the community better. So it was just a real clear nexus for me that the community belonged in the conversation about how you deliver healthcare. And so from that standpoint, I began to get involved with government. In fact, it was somebody from the community who said, hey, there's this thing called this fellowship program. So long story short, 14 years ago, I came to government and began working at the governor's office and executive branch of government and bringing my community experiences into the decision-making rooms. And that has been my motivation, just knowing that the decisions we're making at this level really impact the people who are on the ground and my lives, my family, my community. And so it's an honor and a privilege to be here and to extend that out at this juncture. So I could go on and on, but that's just how I got here.
Thank you. And Ashish, how'd you get here?
Thank you, Cynthia. I'm so excited to be on this panel with you both. I think for me, if you asked anyone who knew me growing up, they would be very surprised that I'm doing anything dealing with like US politics or elections. I think growing up, I felt my parents had immigrated from India, and I think we always felt like we were sort of guests in someone else's country, even though I was born in the United States, was a citizen. So I grew up thinking of US politics as like really interesting, but something that other people do. And it wasn't until the 2004 election where I was studying political science and failed to even vote in the election, and had this moment of like cognitive dissonance where I was like, I've had this like privilege to be able to study political science, and I'm a US citizen, which also is a privilege. And I didn't even bother casting a ballot in an election that I cared about. And so I promised myself when I graduated college that I would at least try to do something. And I didn't really know what that meant, but it ended up being volunteering to go canvassing on a political campaign, which to me seemed like the rudest thing. You knock on someone's door and ask them who they're voting for. That just seemed very bizarre to me. Unfortunately, I had a good partner who I was paired with, and we went out and were knocking on doors in Pennsylvania. And I quickly found that I loved it. And I think for me, what it did was cured me of like any cynicism I had about politics, that I found that people just genuinely were trying to grapple with serious issues with whatever lens they were bringing to it, and wanted to engage in conversation. And not always, I had the door slammed in my face many times, but most of the time, people were really open to talk. And I think like seeing that enthusiasm, seeing that interest sort of fueled my career from there. And so I went to work on campaigns, went to work as a lobbyist, and then more recently in the philanthropic and voting rights space.
You guys have some amazing stories. That's really cool. Thank you, Ashish. One of the last points you made, even though you didn't highlight it, Ashish, in your presentation, was that you saw that there's going to be a number of actions that state officials were going to take this year to make voting more accessible. And so, LaKenya, this is a question for you. Can you tell us more about the California's trends related to the Voters' Choice Act? Because I know it's tied to accessibility and making voting more accessible here in the state of California.
Sure. So California passed SB 450 back in 2017. So as of 2018, counties in California could voluntarily elect to this new voting model called the Voters' Choice Act. In this model, voters have, we call it more days, more ways to vote. Options, of course, by mail, in-person ballot drop box. But the beautiful thing is that they have the option to vote up to 10 days prior to an election in person at a vote center where it has to be staffed and there has to be people there to answer your questions. And so in 2018, about 5 counties decided to do this model. Well, by 2020, 15 counties were doing this. And then as of Dr. Weber's inauguration and my joining the team, I actually head up the Voters' Choice Act for California. And we've got now 27 counties and counting that are growing and expanding the number of days and ways people can vote across the state. And so the beautiful thing beyond there being more days, more ways, is that there's a community engagement model that requires there to be conversations and in the development of the election plan and the outreach plan. So there's a language access and accessibility committee that every county is required to have. And they are supposed to hold meetings on a regular basis to engage the community in learning about what those language and cultural needs might be. So the committee is established. They have a role in statute for developing that plan. And on the other aspect, there's the voting accessibility committee, and that committee is looking at how we provide access to voters with disabilities and challenges, so that they also are part of that process. What we're seeing, though, is with these conversations starting, is that you have more community partnerships happening at the county level with community-based organizations who are already serving the voting population. And that's really what you want. You want people who understand the population to be engaging folks. Another champion that we were able to do last year is setting up a resolution with the University of California to start building those relationships between the county and the University of California campuses, to start offering vote centers and drop boxes on every campus that's a UC in California. Statute already requires CSUs and community colleges to do something like that, but what we're finding at the SOS is that we need to help some of that coordination happen. So Dr. Weber has, been a champion, of course, of equality and equity for a very long time. So we see these moves as a way of expanding equity and engagement across the state. We're also engaging more young voters. We've pre-registered over 1 million high school students who are going to become 18 or older really soon. And then you're going to just see more of that from us as we go on. To date, I'm in talks about 5 more counties who are onboarding to become the part of the Voters' Choice Act. So we do think that as of the end of this year, we'll have more than 21 million registered voters operating under the Voters' Choice Act. And so as you can see, it's really about this collaboration, this engagement, and I hope it does continue for California.
Thank you. You touched on some piece there, and that was like at the grassroots and community level. So, Cynthia, I want to ask you something to follow up on what LaKenya said. Can you tell us about the trends that AltaMed is and the tactics that AltaMed is using this year in 2023 to increase civic engagement in your care settings and at that grassroots, like ground level?
Yes, and thank you. And thanks to I'll say this, thanks to the Voters' Choice Act, this is where we've actually hosted a couple vote centers at our clinics, which is amazing for our communities, and ballot drop boxes where individuals can drop off their ballot if they receive it at home. So we do promote the different ways to vote. The important thing is vote. So we do have that. We just hosted 14 this last election. So we're very excited to continue that partnership with the Secretary of State, LA County, Orange County, of course. But how do we also talk about linguistic and culturally relevant information with our communities, especially non-English speaking, who would like to vote but are a little intimidated to voting? So regarding grassroots and what we're doing with our community health centers, and I'm sorry, I had to give a shout out to the Secretary of State with the VCA and all the hard work there. We've implemented our integrated civic engagement model, and this really takes what we're rooted in social justice as a community health center. These are the safety nets for our community. And if we see where we're located, that's where we have the majority of low propensity voters as well. And if we overlay that with other social determinants of health, you're talking about building upon all these other issues that are really hindering our community to go out and vote and participate. I do want to say some of our community members may not be eligible to vote, but their voice is just as important. So they could urge their family and friends to vote because they're voting for them. That's what I do with some of my family and friends who are not eligible, but I vote for them. So what we do is we have My Vote, My Health. If you could see some of the signage behind is really the message of your vote is your health. So you're voting for your health. We've implemented this model a couple of years, internal and externally. So what does that mean is we're taking our trusted messengers, which are providers, especially in the Latino community and people of color. Providers are the number one trusted messengers, apart from teachers and religious figures as well. And we're integrating this message of voting for your health through all clinic processes, but not interrupting them, of course, because we're a healthcare provider first and foremost. But how does that really affect communities' health? in the sense of a patient coming into our clinics and we could only take care of 20% of their health, and 80% is everything else outside. So how do we, and I don't want to say the word empower because the power is there in the community, is how do we bring these resources and making a space for the community to speak. So we do have, again, this integrated civic engagement model. We work internally with all of our staff, our providers. Our staff is above 90% live in our service area. So we are our own community. In addition, externally. So we work within the radius of our clinics. Again, these are low propensity voters who really aren't being reached by candidates because they don't vote regularly. So it's this misconception of saying, well, the community is not interested. No, the community is interested. The information is not getting to them. So this is where we come in, and we've had, and I know we'll talk a little bit more about healthcare providers as trusted messengers, but we've done canvassing in the community and saying, hey, by the way, we're your neighbors, we're your community health center. We've had providers go out and go door to door and talk about the importance of getting involved. Again, nonpartisan. And you'd be surprised, a lot of people open the door to AltaMed because, oh yeah, you're a community health center. So this is where we really bring in, and of course, culturally and linguistically relevant material. So on social media, on paid and earned media as well. So we do gather those influencers, and we use also a lot of promotoras, and that's the community health workers. Those are the literally the lifeblood, right, of our work to go out into the community. I hope I haven't rambled on, but I could talk forever about all these amazing things that we're doing in other community health centers. Thank you, Rasha.
You haven't. We're receiving all of it. You touched on something that kind of pings over to Ashish's point about the automated voter registration through Medicaid. And Ashish, when you guys are looking at it from the lens that you are sitting in, are there any like methods or strategies that you guys are seeing for healthcare professionals and healthcare workers to really engage and spur that conversation of advancing automated voter registration through Medicaid?
Yeah, it's such an important voice on that issue because obviously it's a state agency that deals with health. And so the most important constituency are the beneficiaries of Medicaid, so those communities served by the Medicaid program, as well as public health professionals and healthcare workers. And so in the states where this has been debated, there are a few voices that are more trusted than those who either as part of their work or as part of their own medical health care are interacting with Medicaid. I think you'll find that one of the most important questions that comes up is sort of, is the integration of voter registration through Medicaid something that deviates from the purpose of the Medicaid agency? And so that will always be a question that comes up, and the ones who are going to be trusted are going to be those who have experience working with those communities who are served by the Medicaid agency. And I think just in general, Cynthia's perspective, which we just heard and learned from, I think knowing what are the barriers to those communities who are served by the Medicaid is also important to surface. And who knows that better than public health leaders, healthcare workers, as well as those people from community leaders from those communities. And so I think those voices need to be highlighted whenever this is sort of debated and discussed. And it's been an important part of why it's passed in the states that it's passed in.
Thank you. I'm looking at the time and I realize that I have a whole host of questions that I want to ask you, but I also want to leave the floor to those who are listening. I know that there was a couple of questions in the chat. And so I want to lift that one back up so we can speak to it out loud. And then if you guys have other questions, this is an open question and answer period. So you guys can drop your questions in the chat. But the question that we got earlier, I'm going to go back to it, and it was, Medicaid, which you were just talking about, Ashish, automatic voter registration is such a great idea. How could this be advocated in California that has Medi-Cal expansion regardless of immigration status? Any takers on that? Ashish, I saw you answered it. If you want to take it, and then if anyone else wants to follow up with it, go ahead.
Yeah, I'd be happy to start and then have others add to. I think one of the most important things with any automatic voter registration policy is how does it protect all of those applicants who go through the process? So the same would apply to DMVs. So DMVs are primarily the state agency that has administered automatic voter registration policies in most states. And the same would apply to Medicaid. If there are any sort of non-citizen who would be put in jeopardy from automatic voter registration policy, that would be a serious, serious problem. One of the strengths, well, not really a strength, it's at least a characteristic of the Medicaid program, is that they require not just the attestation of applicants about their citizenship and immigration status, which I think you don't want to rely wholly on someone's attestation because there can be language barriers that cause mistakes on applications, and you certainly don't want to put anyone in any legal jeopardy. But there's a second step that Medicaid takes where it has to validate that information about someone's citizenship or their immigration status through the Federal Data Services Hub. And that's current status quo. That's not an addition to the program. And so that check is viewed by the federal government as sort of the source of truth on those two. There are some people who will come back from that thing with sort of a ambiguous check, in which case then they ask for additional documentation. And so because of that additional step, Medicaid is one of the few agencies that actually is uniquely suited to be able to register people where there's a mixed statuses, both in households and among the overall application pool of both citizens who would be eligible to register to vote, as well as those who have an immigration status that would preclude them from being able to register to vote.
Thank you. Anyone want to follow up with that? No? Okay. Any questions from the audience? Because if not, I have more. Oh, we've got one. American Indian health centers in California serve a large population of voters. Is there outreach from your organization, probably anyone, to those health providers? Is there outreach to getting ballot boxes at these facilities?
I can take that question.
Okay.
So one thing you're going to see coming out of our office is an effort to be more inclusive in how we talk about California's voter demographic. As of now, there hasn't been a way to identify race and ethnicity for voters, and they don't have to actually report it. And so in some ways, some communities are kind of, I wouldn't say invisible, but they're not being talked about as much. And I would say the Native American population is one of those groups. We are setting up to provide something called the Bayesian infrared surname geocoding, which is where we're kind of geocoding and coding all of our voter files to determine who's who and where they are. And so an effort in partnership with UCLA, we are working to identify our Native American population through our voter file so that we can increase outreach and education. So we can know what the barriers are, if there are, I shouldn't say if there, we know there's always barriers. Whether it be transportation, just being a hard to reach population. So we're using that system to identify voters. That's one thing. A second thing is we're using the U.S. Census to actually identify hard to reach populations. They defined it for us in the 2020 census, and using that criteria to inform counties about their demographic and their population to ensure that they're aware, hey, you have these many people of this challenge, or whether it be poverty, whether it be education, access to broadband, race and ethnicity, homelessness, joblessness. So looking at all the different social impacts to each county and each tribes who often are outside the county, right? They're on tribal lands, yet they're still voting. And so I'm excited about that because we're increasing visibility. So yes, we'll be able to increase outreach and education that way by knowing who is getting the information, who's not getting the information, and partnering with counties. I do want to say one more thing that I don't want to go too far, but we have the Voters Choice Act Ambassador Program, and that's an opportunity for every single organization, every student, every individual to join us in becoming a messenger to voters, a trusted messenger. We do have a vetting process, of course, but that's just mostly you taking a pledge, agreeing to be nonpartisan, and agreeing just to really uphold democracy by engaging voters with correct information. So we're partnering individuals and organizations with the county so that they can do a better job of outreaching and making sure we're including all of our populations. But we're excited about the roads forward and the inroads made for engaging the Native American population.
Oh, thank you. I really like that. I didn't know you guys had the Voters Choice Ambassador Program. Everybody Google it. There's another question. It was a follow-up to Pat's. How can clinics and hospitals get ballot boxes at their location? What's the process and protocol?
I can answer that question too. So counties basically do what I think you heard Cynthia and as she's talked about. There's an overlay and mapping and decision making on where those ballot boxes go, and they have a number of factors for such as proximity to public transportation. Is there parking? Is there what's the population need? But the counties have the opportunity for you to join their language access committees, their accessibility access committees, and that doesn't mean you have to have a disability, but we're encouraging people to get involved at the county level and join those meetings. That's how you get to speak up and say, hey, we'd like to have a voting drop box placed here, or hey, our community serves this population and we think they really trust us. So we know that if you have it here, voters will participate. So it's really at the county level that you're able to engage, and they map them out. We approve of plans, of course. We look at the plans, we make sure that the plans are inclusive. And so we're right now preparing for the 2024 election. So you ask, what do you do in an off year? In an off year, we're working with counties right now on a calendar and a plan that includes these public engagement meetings that actually include public hearings, workshops, opportunities to review the county plan. And so, that's the work happening right now. So right now you can get involved at your county level. I can put some stuff into the chat about Voters Choice Act and which counties are participating in this overall plan for outreach. And then I'll also put our email address in. If you want to become an ambassador, you can always email us directly. You don't have to Google it. It'll help give you more information about it.
Thank you. Ashish.
I was just going to mention that this is also one of those issues when it comes to ballot drop boxes, that funding can be such an important aspect to this. So depending on the state and the local jurisdiction, fundings are restrained from being able to employ as many ballot drop boxes as I think local jurisdictions would want, to making sure that they're in every sort of nook and cranny that someone could be accessing and using, to no matter what community they're from. And the proper and adequate funding of elections would allow for more access. And that's one of those things where, like, I work on policy all the time, and not every question can be solved simply by legislating. And this is one of those where increased funding for local election officials could allow for a lot more ballot drop boxes. And those states with vote by mail, they found that most voters really enjoy being able to return it in a ballot drop box rather than actually mailing it or any other type of return. And so I really appreciated that question because it's such an important for vote by mail.
So if I may add, and since we've hosted vote centers and we have a ballot Dropbox, actually one of the counties where our clinics are at, we have to go a step beyond too when it comes to education amplification of this resource for our community. At times, if you have, we receive the ballot right in the mail 29 days before, a lot of our community do not understand or may not have the support needed. So what we've also done as well is they could come to the clinics where they come to get their physical, when they bring their child for immunizations, drop it there, ask questions. We have all this information. Last year, we partnered with the League of Women Voters, California League of Women Voters, with their Easy Voter Guide, which is amazing in English and Spanish. And if you go onto our website, you'll see pictures of all our staff and patients using it as a model as well, and highlighting areas, which is great. But again, it has a trusted messenger where our patients and community feel comfortable in casting their ballot. And then some people, again, prefer to drop it off in person, vote in person. That's okay as well, as long as you vote. That's a big message. And I do want to say just really quickly, when we say, and we encounter a lot this with our staff and our patients, well, I don't want to be involved in politics. You know, this is I have no idea. And I said, well, politics is interested in you and they want to be involved with you. But beyond that, civic engagement is not politics. It's engaging. It's not just voting, it's census redistricting. So the model that we have developed, you could apply it to different programs and amplifications. But in your healthcare organization or as a healthcare provider, you could start with small steps, talking to leadership, and then talking about actually having vote centers and ballot drop boxes there, but having a unified message. That's the biggest one.
That was actually my last question. I was like, ooh, in one word before you slowly wrap up, what can healthcare providers and healthcare delivery organizations do this year to advance civic engagement in 2024? One thing, what can they do? Cynthia gave us one.
Really quickly, I'll just say we heard from the University of California that hospitals are asking for voting drop boxes in the hospital to allow the medical staff to be able to vote on election day. That it's hard to get off on election day to go vote. So that's one thing you could do. Become an ambassador is number 2. So.
Thanks. Ashish, do you have anything?
Yeah, I would say that do not underestimate the voice that you have as either a public health institution, public health professional, healthcare worker. It is something that is so valuable, and groups like Civic Health Alliance and others can help sort of guide you in terms of the best way to amplify your voice and to really have an impact when it comes to civic engagement. You all are such trusted messengers on voting and on just taking care of communities, and that can go a long way for building trust as well.
Thank you. So there's a few ways to stay connected with us in this work and our partners and AltaMed, Sheesh, and Kenya. You can follow us on our Facebook channels, our Instagram, our Twitter. I think I just saw Jessica put in the chat that she was going to take this conversation over to the Twitter feed. So if you guys are at all interested, you can meet her over there. On our LinkedIn, we're pretty active on all of those platforms. And I want to tell you, just thank you for joining us. We sincerely appreciate the time of our just panelists, Ashish, Cynthia, Kenya. We are sincerely grateful for the work and commitment you guys have just, displayed for civic engagement. We appreciate your time today. We hope that our folks on the line got something out of this. They were able to learn something or feel inspired and realize that 2023 is actually a very big year. So we don't see all the news, talking about the elections yet, but this is a pivotal year, and this is the year that we really remain engaged. So I just want to tell you all, thank you. We put our survey in the chat. I think we'll put it in one more time. We would just ask that you just fill out the feedback survey. Tell us how you feel. Tell us what you're thinking about these events. We'll continue to host them if we get the thumbs up. And don't forget to scan that QR code. You can check your voter registration status looking at that QR code, or you can use that QR code to automatically register to vote. And so with to get you into the system, it'll either check the system for you or to get you into the system to vote. So thank you all. We appreciate your time. And once again, thank you to the panelists.
Thank you, Russia, and thank you, Civic Health Alliance. Thank you, Cynthia and Ashish. Pleasure to meet you both. Keep doing the great work you're doing out there.
Thank you. Good night, everyone.
Good night, everyone.